2003, my wife and I heard about the struggles in Mikinduri from McKenna Ambassa, who operates out of Africa. And as a result of that, we formed an alliance with some other people who were concerned. And we actually tried to work with other organizations to get some work done, and nobody wanted to work with us because they thought we just wanted their money. So we decided that because the need was so great, we'd just start and we'd find somebody else later. Well, as it turned out, we didn't find anybody else later, so we've just continued to go along and try to do the best we could. One of the great privileges that I have is being able to travel to Mikinduri. I go at least once a year. You have to go to check on your projects and so on. And I can tell you that that I am blessed and privileged to be able to go there to meet, mix it up with the people, get to know the people. I'm truly blessed to be able to do that. I come home a much more enriched individual than before going, so I'm grateful for that experience. We're also a registered charity, so we're able to offer receipts. Thanks, Wes. Our mission is to work with the absolute most needy in the Mikinduri area of Kenya to help relieve extreme poverty through the introduction of timely, efficient, and effective community-driven projects with an absolute minimum of overhead expense. We try to make sure that the people that we're serving are really very needy, and so we have ways of verifying that in our various projects. When you travel to Nairobi, Mikinduri, we land in Nairobi, which is right there, and Mikinduri is just up there. Mikinduri is about a 5-hour drive. This is Mount Kenya right in there. So we drive past Mount Kenya, which is interesting to see. And so it's about a 5-hour drive from Nairobi to Mikinduri. Mikinduri is really quite a remote village. It's really quite far out, removed from the main line of civilization there. So getting out there and living there is really a great experience. Thanks, Wes. This is just some of the topography that we see in the way. It's lush country. They grow a lot of coffee and tea. They're famous for their coffee and tea. And other crops, local crops like corn, maize, that kind of thing. This is a picture of the village from up high in the hillside. It's a village of about 4,000 people. It serves as the economic and business center for a much larger area. The population base that we try to serve is about 80,000 people, going out as far as 35 or 40 miles in either direction. So we work with many smaller communities, like outside, for example, out around these mountains. There's villages up in these mountains that are really, really destitute, and these are the places that we try to get to serve, and we're always finding new villages by word of mouth. When I was there last year, I heard of another new village called Rotary, and as a result of that, we've now started a feeding program there. These places are really quite remote. This is beautiful downtown Mikinduri. That's the main intersection. We've gotten to know a lot of people there, so we have lots of friends now. It's a pleasure to get back and meet the people and experience life with them. I used to be asked, what is poverty? It's having no money. Poverty for me now means not having any options. What I mean by that is this, and I'm going to show you some pictures, and I'm not trying to be spectacular about, I can't think of the right word, but I'm not trying to, I'm really just trying to show you what life is like for people in Kenya. And the reason that some of the conditions of some of the people that you're going to see is not because they're stupid or backward or uneducated, it's because they have no money. And if you don't have any money in Kenya, you don't have any options. If something happens to me today, I can find all kinds of people that will lend me a bit of money, drive me to the hospital, buy me some food, drive me to Surrey if I need to get there. The people in Kenya don't have a safety net like that. They don't have any options. They just have no options. So they'll die at home. They will not go to a hospital because they know when they get there, they don't have 20 cents to pay the bill to be admitted. So that's what poverty is for me, is having no options. Most of the people live on far less than $1 a day. Like this lady, for example, she's a grandmother taking care of her grandchildren because her children have died. And that's the story. Very often you've heard that time and again, that AIDS has taken the middle class, the middle-age group people out. So the grandmothers and grandfathers are taking care of the children. And it isn't just grandmothers as well. Sometimes it's grandfathers. Yeah, Wesley, you want to go ahead, please? One of the things that happens in Kenya and many third world countries is that the women form the backbone of the country. The men have all the say, they have all the authority, and the women do the work. And that's I'm not being grandiose, but that's the way it is. The women do what the men say. So people ask me, well, what do the men do all day? They spend all their time trying to plan what the women should do. There's a man whose wife had died, and he's living, they have these mud huts, and this man is in dire poverty, he has 2 sons, and there are many people in that situation. So when we first went to Kenya, we tried to find out what it was that they needed most. And the way I describe it is that the area had been ignored for years and years and years. There were no NGOs in there. There were nobody in there doing any kind of charitable work. So when we went in, the first thing we had to do was an assessment of what were the things that they needed. And it was like a bucket with a whole bunch of holes in the bottom. So the first thing we started having to do was to have feeding programs and emergency medical programs and those kinds of things to give the people a sense of assurance and also to help build trust with them, because sometimes people would go in, they'd stay a day and they'd leave and never come back, make promises and never come back. So it took us 2 or 3 years for them to believe that we were really intent about making a difference in their lives, trying to help them to make a difference in their own lives. So the first thing we had to do was to start feeding programs, because the kids were literally falling down on the streets from malnutrition. The mothers and fathers were unable to get out of bed because of diseases like malaria and typhoid and other diseases. So the first thing we did was we started nutritional programs. The second thing, which contributes a lot to those diseases, is unclean water. So we had to start clean water delivery programs. And then, because of the number of orphans and so on, we wanted to try to make sure that the children had an opportunity to have a future. And so we partnered with Chalice, which is a Nova Scotia organization, and we now have a family sponsorship program in Mikinduri. We also have a health and wellness improvement, which includes education on nutrition, cleanliness, that kind of thing. And now that we've got some holes filled in the bottom of the bucket, we're now at a stage where we're starting to build up, we have been for a couple of years, starting to work with them to develop income-producing projects, things like a sewing center, charcoal manufacturing organization, those kinds of things, better crops, better agricultural future, and so on. So, and we also have an educational program, because many of the kids there don't get to go to school, and they realize that education is the future, and so we have a program in place to help them get on to secondary school. And then we have an agricultural development program. They have, for years and years and years, they've been farming exactly the same way, very same way for decades, for generations. And so one of the things we were trying to do is to help them to understand that there are better ways to grow corn, better kinds of goats that you can breed and produce extra milk, and they're healthier and they stand up to disease more. So that's part of an overall development program that we have in place. And each year we take a team of people in February of each year. Last year we took 31 people. We did vision, dental, and medical clinics. And our trip, we're already planning for February of next year. We have 26 people signed up for next year. So a few slides on the feeding program. 7 years ago, we started the first feeding program at this building. McGill University engineering students came to Mikinduri and spent 3 months. They did all the labor and all the planning, design work, and the labor to build this building. We financed it and they built it. So this is now a cultural feeding center. Our plans are to introduce solar lighting so that the mothers and grandmothers can go there at night and do some of their craft work and produce income. As well, the students can go at night and do their lessons and so on, because it gets dark there every night at 6:30. By the time they do their work in the fields, they don't have time to study. So this will benefit them by getting them, give them an opportunity to get some excess study time. We see all kinds of people coming to our clinics, our feeding centers. This young lady with 4 kids, her husband died of AIDS, she has AIDS, her 4 kids have AIDS, and the children are just severely malnourished. So we have people that follow these kids up to make sure that they get ongoing nourishment and checkups and so on. This is one of the feeding programs. The kids are fed a nutritious meal. This is the second last feeding program we started. The kids here get fed twice a day. There's 200 kids at this school. It's quite remote. It's about a 45-minute drive, really bad road from Mikinduri out into the country, and it's at a school. So there's 200 kids are fed twice a day. They're fed porridge at 9 o'clock in the morning, and then they're fed lunch at 1 o'clock. And enrollment is increasing because kids will come to school to get fed. That's part of the reason why enrollment is increasing, not because they want the education, but because they know they'll get fed. This is another, that's the last picture there is a feeding program we just started in March of this year in that village up in the mountains where the school had closed, the tiny school they had closed because they couldn't afford to hire a teacher, that they pay $300 a year. So when we heard about that, we got our specialists up into the mountain, and we now have a feeding program in place. And there are 32 kids back in school. We're working on improving the roads, getting them some water and those kinds of things.
The opinions expressed in the following program are not necessarily those of Eastlink TV, its sponsors, or partners.
Our water projects. Water is a serious issue. Go ahead, just Wes, please. That water was tested, and when we complain about our water in Canada, we're all running around drinking bottled water and so on. We had that water tested, and that water tested, the E. coli in the water tested at 1,800 times higher than the World Health Organization suggests that you drink. The people have no choice but to drink it. They have nothing else. So one of the things that we have to do is find them ways to get better water, and there are two ways to do that in Kenya. One is to dig wells, and that's a hit or miss proposition because sometimes you can dig a well. Mikinduri is about 40 miles from Mount Kenya. You have volcanic lava there, and sometimes you can hit water, sometimes you can't. Sometimes you hit acid. We've dug 7 wells, and only one of them were successful because of those circumstances. We've had to give up on the wells, but we are having success with water pipelines. So we have 3 water pipelines in place, as well as that one well, which you'll see a picture of in a moment. But no matter what the situation is, once again, it's the women that are doing the work. Here's a lady that has 50 pounds of water on her back and another 20 pounds on her head. You know, when we go to the store and we drag one of those bottles of water out and we're humping it along like this, well, this woman travels 2 miles like this, and she makes her living doing this. She does this all day long because she has a neighbor who has cattle and can afford to pay her. So it's amazing the strength and it's just amazing the courage of the women in Kenya. Absolutely amazing. I am humbled every time I see them. This is a situation. This was a well that was dug. It was down 50 feet, and we hit so much volcanic rock we had to give up on it. And these are dug by hand. The men are down in the holes. They scramble up the side of the wells by foot. This is a well that was sponsored by the city of Charlottetown. This is an operating well. It's at a place called Marega. That serves about 100 families. It's at the moment, in fact, starting in September, starting this month, we're doing a deepening of the well because there are times during the year that when the water table drops too low that they have to deepen it, so that we're in the process of doing that. And then we have 2 pictures of pipelines. There's one pipeline from the mountains. This is a Kaiga mountain, and there's 2 springs up in the mountains, and the water comes down here to this section. This is a school here called Kaguro School. That's where the 200 kids get fed every day. So they bring their containers to the school and they take the water home. Last spring, during there was a drought in Kenya, not this spring, but the previous spring. There were Somali camel herders were from 60 miles away. They were coming to get water at this pipeline. It's amazing how much they have to do. In fact, because of some of those conditions, the pipeline was busted for a while because the animals were going up into the mountains and treading on the pipeline, and we had to replace parts of it. There's another one in a place called Kiguru, and that's another school there. So our health care, we have 2 elements to our health care. One is our annual medical clinic, dental, vision, and medical clinics. And then because the health care system in Kenya is in such bad straits, I always get a kick of recently we've had all this press about how bad our hospital is. Well, in Kenya, the population of doctors, of people to a doctor is 65,000 people to 1 doctor. And part of the problem is our problem. We caused the problem because what happens is the Kenyan government educates the doctors, and then we go in, offer them big salaries, and draw them away.